Good evening, ladies and gentlemen. I just wanted to let you know we'll be shortly starting this evening's webinar. We're just waiting for a few late attendees to join, and then we'll get underway. So just bear with us a couple of minutes. Okay, thank you very much for joining us this Friday evening on what was a nice sunny but cold day. Welcome to this evening's webinar. My name is Suvir Venkataraman and I'll be your host. So first, I would like to introduce you to our topic tonight, which is patient support and holistic care. And I am privileged to be speaking with a highly experienced and lovely panel. First on the panel is Miss Mollie Graneek, our counsellor, and then we have Miss Carys Morgan, our acupuncturist, and Miss Carina Nobrega, who's one of our patient coordinators. So I would like to give you an overview of this evening's agenda. So we'll have some presentations from each of the panel covering the various topics. So I'll start off by talking about the role of patient support, and then I'll hand over to Mollie to speak about counselling and its role in infertility, and then to Carys to speak about acupuncture and how it relates to fertility. And then we'll go through some frequently asked questions on both counselling and acupuncture, and then we'll have a bit of a wrap up from Carina before we finally take a live Q&A from the audience. And if you wish to ask a question, please either raise your hand using the functionality on Zoom or submit a question via the Q&A function again on the platform. The event will be recorded and it will be uploaded on our website for you to access at a later date. But if you want to stay anonymous, that's no problem. Just keep your camera off and you don't have to say your name in a question or if you wish to speak. So without further ado, I will get started. So, the whole point, or one of the main reasons rather, of when we founded Harley Street Fertility Clinic was we felt that some of the other clinics, the private clinics in London, they were really good at what they did in terms of their clinical care. However, we felt that the patient support was a bit lacking. Clinics had grown and they'd become very large and busy, and they'd been structured for an efficient operation, but it didn't necessarily suit the needs of the patient. So we decided to rethink the way that things were operated, when we wanted to make sure that we provide continuous clinical care because we feel that helps with patient support, but also, provide a more holistic based approach to emotional and mental support for our patients. And so, this involves relying on counselors and acupuncturists and hypnotherapists and other practitioners to make sure that the sort of individual needs of each patient is catered to, because everyone's slightly different and what support you need might be different to the support that someone else needs. So at this point, I'd like to hand over to Mollie to talk about the role that emotional psychological support play in fertility. Thank you, Mollie.
Good evening. It's pleasure to be with you, and I just really want to talk about my role as a psychological therapist, counsellor, specialist fertility counsellor, and how I believe counselling benefits people who are going through a very difficult emotional fertility journey. I think, first of all, people who come to the clinic, they're a bit bewildered about why they can't conceive naturally. They're often faced with the process of having to go through different treatments, and IVF figures very, very, very largely in the treatments that we offer our clients. So we talk a little bit about the emotional support for IVF. We go on IVF with donor eggs, donor sperm, is becoming extremely prevalent in contemporary treatments. Egg freezing for social reasons, egg and sperm donors, and the social and the moral implications of what this all means. And I think, if we look at some of the social moral implications, people who come to the clinic who have tried unsuccessfully to achieve pregnancy through IVF, or indeed naturally and then following natural through IVF, they're often faced with the possibility of having to use a donor. Now, initially, patients seem to be almost horrified with the prospect of not being able to conceive with the person they love, with the eggs or the sperm of the person they love, and having to push the boundary into the concept of using a donor. And I think a lot of people's concerns around the donor and concerns about the potential for donation, for the exploitation, if you like, of egg donors, is something that fertility clinics address on a daily basis. And questions of morality, legality, compensation remain debatable and sometimes unanswerable. As a specialist fertility counsellor, I'm often faced or asked to comment on people's decisions for egg donation and whether or not I approve of it. And I think in essence, it's not for me to approve, it's not for the clinic to approve, it's for us to offer a service to people who need to add a different dimension to their fertility treatment. And I think, contemporary fertility treatments are often challenged, and I was certainly brought up in a very deprived area of Glasgow, which was heavily influenced by the Roman Catholic Church. And I often reflected on the moral and ethical sort of issues around controversial medical treatments. I think when the Abortion Act was passed in 1967, I was 12, and I often reflected on my parents' views on this process, and what appeared to be a so almost indiscriminate loss of life. I think, however, in spite of society's apprehension about, sorry, there was a call coming in there, apprehension around new medical techniques, they continued to improve. And in 1978, the first test tube baby was born. The birth of Louise Brown was deemed a miracle. And, this medical breakthrough became a symbol of hope to women who were unable to conceive naturally. But again, the ethical and the moral aspects of test tube babies, test tube conception, was challenged. I think, like abortion, like test tube babies, egg donation raises similar ethical, moral, and of course, religious issues. It began, I think, in the 1980s, and the first pregnancy resulting from this technique, that is egg donation, was reported in Australia in 1983. But in this country, when egg donation was introduced, the eggs tended to come from friends or family, close friends, close family, and or indeed women who were undergoing IVF themselves. And I think the practice continued to expand now, and across the 21st century, we find ourselves swamped with the need for donated eggs, donated sperm, in order to cope with the demand, that contemporary demands of fertility treatment. And I think as a result, egg and sperm donation were taken almost to a corporate and commercial heights. And the practice has been the subject again of debate and criticism. Again, as a fertility clinic and as a fertility counsellor, it's not for us to debate whether these things are right or wrong. It's for us to seek and continue to support people through their own needs for fertility and for their own sort of choices in fertility. And this is often something that people struggle with. So offering support through counselling, there's no real magic to counselling or therapy. And I think I've said it before, the master of counselling and therapy, the inventor of therapy, Sigmund Freud, he calls it the talking cure. And talking, is healing. And therefore we encourage our clients to talk about whether they feel comfortable, going through IVF treatment, whether they feel comfortable with egg donation, with sperm donation, and if not, how we can support them to come to a place of acceptance of that treatment. We also support young women who socially freeze their eggs for all sorts of, again, contemporary reasons that, social egg freezing, as we call it, women who have careers, women who haven't met the right person, they want to freeze their eggs so that they can maximize their chances of fertility in the future when they're in a better social or emotional place to proceed with treatment. One of the difficulties that we often experience with young women coming into the clinic, and why counselling is so important before they embark on the journey of freezing their eggs, is the fact that they're about to expose themselves to some tests which may indeed tell them that they have no eggs to freeze. This is something that we don't always want to see. We certainly don't want to see it at all. But this is something that we have to prepare young women for. And so it's important that we talk about the implications of having eggs to freeze or not having eggs to freeze, and what that indeed would mean for them. So social and moral implications of all sorts of donation is extremely important. We have the next slide. IVF with donor eggs, we've kind of spoken about the philosophy about it. You know, I think, again, it's not something that women or couples actually want to consider, but faced with the prospect of remaining childless, they often push the boundary and will then accede to the possibility of creating a family through a donation. IVF with donor sperm, again, is important. It's important that we talk to the donors and the recipients of all donated gametes. And it's important for their emotional well-being, and it's important for the well-being and the emotional well-being of any child that results from the donation. The fact that in the UK alone, which is a pretty small community compared to the rest of the world, something like 3,000 children every year result from donation. And it's important that donors and recipients have the opportunity to explore with a therapist, with a fertility counsellor, what that actually means, what that looks like for them and for the children that results. This is something that we feel very strongly about in the clinic when we're offering not just a clinical treatment process, but a holistic and emotional treatment process as well. Is there another slide? Egg freezing for social reasons. I think I've already dealt with that. The fact that so many young women in this country are being encouraged to freeze their eggs because they don't seem to be in any hurry to create their families at the optimal time. I think, again, when I was at school, we had school nurse and doctors used to come in to the classroom to teach us about reproduction, to teach us about sexually transmitted diseases, to teach us about unwanted pregnancies, HIV, AIDS. We're now trying to establish, going into schools to teach young women in particular about the limitations that their fertility has, i.e., to try and create their family before this optimal age that we all dread of 35, when we know that fertility drops. So egg freezing is certainly a very contemporary, and it's becoming much more affordable process that you know, is certainly something that we would like to see encouraged in younger people. Another slide. Oh, I think actually we're going on to acupuncture. So I will pass you on to Carys, and would be more than happy to take any questions about the counselling process at the end of the session. Thank you.
Thank you, Mollie. That was really interesting to hear you speak. Okay, acupuncture. The aim of what I want to do now, I'm Carys, and we're working at the Harley Street Fertility Clinic for over 4 years now. And I'm really grateful to Dr. Venkat for having the foresight to respect my profession and for giving me an opportunity to showcase my expertise within the clinic. There aren't many clinics that have an in-house acupuncturist, and I've always believed in complementary therapy, and I prefer the word complementary to alternative because I'm both happy and privileged to work right alongside Western medicine. I know for sure that I have Dr. Venkat's respect, and I think I've got her attention now. So My aim by the end of this presentation, I would like you all to have a greater understanding of what acupuncture is and then how it works holistically. I'd also like to share how acupuncture can support IVF programs on not just a physical level, but also an emotional and spiritual. Can I have the second slide? Okay, so before I talk about how acupuncture can best support patient care, I need to explain what acupuncture is. I would like you to forget about any preconceived ideas you may have regarding acupuncture and to listen with a very open mind. The television likes to sensationalize treatments, and they usually depict someone with hundreds of needles all over them, which makes for great viewing, and it is quite funny. However, I promise you just a few well-chosen needles are all that is required in each session. So let me explain a bit further about what Chinese medicine is. Acupuncture is actually an ancient Chinese medicine-based approach to treating a variety of conditions by triggering specific points on the skin with very fine needles. So the needles I use are about the width of a hair on your head, and there's no pain, but there is a little sensation when I actually contact someone's energy. It is a minimally invasive method to stimulate nerve-rich areas of the skin surface, and it can so influence tissues, glands, organs, and various functions of the body to include hormonal balance. The concept of qi, spelled Qi, but pronounced qi, lies at the very heart of acupuncture. Qi is simply that which makes us alive. It's our life force, it's our vital force, it's the essence of who we are. Chinese medicine is founded upon the study and observation of our internal energetics, our qi, its flow, its rhythms, its cycles, changes, movement and balance. All traditional acupuncturists strive to deepen their understanding of the nature of a person's qi in order to determine how best to restore a more harmonious state of health. I believe our bodies want to be in a natural state of well-being, and each needle inserted in an energy line known as a meridian gives a signal to the brain to let the body know that it needs to respond in some way. Acupuncture gently invites the body to find its own natural state of homeostasis, its own natural state of balance or order. The skill of the acupuncturist is in the selection and the combination of a few well-chosen points to gently nudge the individual's body back to a state of health. At the basis of Chinese medicine is the belief that the body and the mind are intrinsically linked, and that the mind can create a dis-ease of the physical body. Therefore, acupuncture is a therapy that will treat the mind and the body as an inseparable unit. Our emotions can create internal disturbances of our qi, resulting in ill health. And acupuncture strives to free the individual from being dominated by strong emotions that can interfere with the smooth flow of life force. It aims to restore the spirit of a person by balancing the emotions, freeing the mind, and restoring a natural order within the body. Can I have the next slide? So how can acupuncture support IVF? So Chinese medicine, as I've just discussed, offers a very different way of viewing and diagnosing health. It's safe and completely drug-free. And I believe acupuncture can be highly effective in a supportive role alongside assisted reproductive techniques. Ideally, I like to see patients at the beginning of their IVF journey in order to gain an accurate insight into their energetics before the influence of the IVF medication. This helps me to understand the individual blueprint of a patient, to work on any existing imbalances that may be blocking a successful pregnancy. I can then work right alongside Western medicine to enhance outcomes by tailoring treatments to an individual basis throughout the IVF process. So even before the IVF journey begins, acupuncture can help to regulate menstrual cycles in preparation for assisted reproduction. So it can help to address hormonal imbalances, and I've had much success in regulating conditions associated with infertility, like polycystic ovarian syndrome, PCOS, and also endometriosis. During assisted reproduction, it can support Western medicine in stimulating follicular growth, and it can help to improve egg quality. It's also very beneficial in that it can help to slow down the rate of diminishing ovarian reserve. And I've had a lot of success in that. And strangely, if I get someone's blood tested for their AMH levels to show their ovarian reserve, and 3 months later with acupuncture, I've actually somehow managed to get that reading higher. So I don't really know the science of that, but I get the results, so I keep doing it. During stimulation of the follicles, acupuncture can relieve some of the more negative side effects of the Western fertility promoting drugs, such as bloating, headaches, and some tiredness. So this can really help to make the fertility journey a little bit more comfortable. After egg collection, acupuncture can help to restore the body back to its optimal health, ready for embryo transfer. It can give the body a bit of a rest before the next Western drugs. Also, in the lead up to embryo transfer, acupuncture can encourage a rich blood supply to the uterus. And this can help to increase and maintain an optimal thickness of the lining of the womb required for implantation. Acupuncture immediately before embryo transfer can help to prepare the uterus by triggering mild contractions. These can facilitate the implantation process. It can help to relax the muscle tissue to give the embryo the best possible chance to implant. After embryo transfer, acupuncture can help to settle the uterus back down again. It can also help to calm and settle the patient. I can usually observe that patients can be running on adrenaline following their medical procedures, and that goes with egg collection and scratch and wash as well. And I find acupuncture can really help the body to restore its natural balance. So I'm going to give you a bit of the science if you want to look this up, if you want to Google this. In 2002, a team of German researchers discovered that acupuncture significantly increased the odds of pregnancy among a group of 160 women who were undergoing IVF treatment. 42% of the women who received acupuncture got pregnant, compared to 26% of those who did not receive the treatment. This is a well-documented piece of research. And if you Google acupuncture IVF and the German protocol, you can read up a little bit more. Research has also shown acupuncture can boost fertility in men. So often people think acupuncture is just for the women, but it's very good for male fertility too. Male infertility is the cause of about 30% of couples who cannot conceive. And a 2005 study published in Fertility and Sterility showed acupuncture can treat male infertility by increasing the number of normal sperm and decreasing the number of defective sperm. Again, that's a good piece of clinical-based evidence behind acupuncture for male fertility. I personally think, though, that the most understated help acupuncture can offer is in the fertility journey, is in the ability to aid relaxation and support the emotions. High stress levels have been proven to contribute towards higher levels of both infertility and miscarriage. And in Chinese medicine, stress is considered to be the #1 reason why a woman is infertile. If I have done my job effectively, you should come away from each session with an overall sense of general well-being and calm. You should feel uplifted, more vital, and ready for the next step of your amazing and individual journey. And then finally, if I can have slide 4. Thank you. Beyond fertility. And yes, there is a beyond fertility, I promise. Acupuncture can also help to support and stabilize early pregnancy. Before I became a fertility expert, I spent over 12 years as a pregnancy acupuncturist and treating women during their pregnancies and also during childbirth. And after And since it is safe and so drug-free, it can safely address conditions like morning sickness and some of the other less serious side effects of pregnancy. It can improve pregnancy outcomes where there have been recurrent pregnancy loss. And from my experience, acupuncture throughout pregnancy increases the likelihood of a successful birth by supporting the body's overall health during pregnancy. And there is so much I could go on to say about pregnancy. You've hit my specialist subject, but I think I'd probably better leave it at this point and hand back to Suvir for questions. Thank you. Thanks, Suvir.
Thank you, both of you, for very insightful talks. It's always very informative listening to these. So next, I'd like to go through some frequently asked questions that we typically get from patients. So we'll have it as a bit of a fireside chat, if you will. So we'll start with the counselling side of things. So Mollie, does stress impact fertility, and how can counselling help? And how do I know which type of counselling is best for me?
I think one of the paradoxes of stress in fertility is that we tell patients not to stress because it impacts their fertility and indeed reduces the potential for natural fertility. But at the same time, when we tell people not to stress about fertility and the fact that they can't conceive, then they're going to stress about it. We tell them not to let their fertility, journey consume them. But then we expect them up at the clinic every sort of other day for one test or another. So it's very difficult to put these, things into context. And of course, stress affects every aspect of our life. And I think I've spoken before about the effect of stress on our bodies in general. And I think, Carys will, back me up in this with regard to the energy, flow in the body. And when the body's stressed, it produces stress hormones. It produces adrenaline from the adrenal glands, and it produces cortisol from the cortex of the brain. And when these stress hormones circulate in excess, they have a manifesting effect on our bodies. That's when we start to experience the physical sort of symptoms of stress. We hyperventilate, our heart beats faster, our muscles become tense, and we get anxious. And the tension indeed takes up space in the body, space that is needed for the natural flow of conception. So yes, stress affects fertility as it does every other aspect of our life. Fertility counselling will talk you through how to manage the stress. We can't abolish stress in any, sort of shape or form. We have to manage it. So counselling helps to manage the stressful sort of processes that are triggered by infertility. What type of counselling? There's many different orientations of counselling, and it's about finding the right counsellor for you. Counselling is a dynamic and it's relational, and it has to be something that both, the client can feel comfortable with and engage with somebody who's going to support them through the next phase of their fertility journey.
Thank you very much. And I think that hands on quite nicely to the next question, which is how can, stress be tackled with acupuncture as well, Carys?
So I think I did touch on this, but because acupuncture sends a little electrical impulse to the brain to calm the brain down, it's actually increasing the dopamine, the feel-good neurotransmitters in the brain. So it's very effective after any trauma, and just to keep someone's emotions stable anyway. And also, for real traumatic events like a stillbirth, there is a lot that can be done to recenter the body after that as well, not just deal with the emotions, but to deal with the major impacts and shock to the body, as well as the mind and the emotions. So again, I would treat very holistically every area to support and help that woman.
Thank you very much. And I think you've already touched or covered the next couple of questions about, the impact, the biological impact of acupuncture. You talked about the energy flow, and how else it can aid with fertility. So we'll skip over those. And similarly, you mentioned the success rates. So we'll go on to the next slide, which is when is the best time to start? Now, I'm going to ask this of both of you in terms of counselling and acupuncture. I'm sorry, it's not on the slide. But Mollie, again, starting with you, when would be a good time to see a counsellor or a therapist when thinking about fertility?
I think it very much depends on the individual, but of course, the more support you have through a fertility journey and the earlier it starts, the better. It prepares you for every step of the way. And I think, fertility is a process, and we can only treat it as a process. So we deal with one thing at a time. Very often people come to see a counsellor or therapist when things go wrong. And yes, that's partly what we're here for, but we're also here to support you on the journey through, a positive journey when things go well, to help you achieve that sort of well-being.
And Carys, how about acupuncture? I think you touched a little bit on this when it comes to treatment, but what about someone who's trying to conceive naturally?
I think really a good 3 months before they're even trying to conceive, just to get the body to make themselves, I believe the body is in perfect balance, we're going to get naturally good results. I think to prepare the way to get someone's energy strong so that they can withstand the Western medicine side of it. And I think the two complement each other really well on that, in that I can prepare the body in the months before, and if there is, so many different reasons for infertility, but the earlier you start to balance your internal flow, the better you're going to withstand the whole of the IVF process.
Thank you. And then on some of the specific conditions that you can help treat, you mentioned, PCOS, but what about things like a low AMH or, in men, a low sperm count?
So before I became a fertility acupuncturist, I was helping women to fall pregnant actually without IVF. And I've had huge success with women with very low AMHs, is supporting them, supporting their general health. And I've had successful pregnancies for women with as low as 0.1 and 0.2 AMH. And I'm fascinated by the results that I can achieve. And that has really spurred me on over the years, just to, I'm dedicated and passionate about what I do because of the results I get. And I don't always understand the intricacies of how I've got that result, but I keep going because I know that I can make a huge difference to women by rebalancing their bodies again.
The proof is in the pudding. You mentioned a little bit about any possible risks or side effects, and a lot of patients do ask the question, would it be harmful if I was to have acupuncture around the time of embryo transfer or implantation in some other form of treatment?
Yeah, and I think those fears are absolutely appropriate to have, because there's so little known about acupuncture. I mean, we know about acupuncture for sporting injuries, but not much is out there about how acupuncture can support those kind of things. And my own experience, I came to acupuncture because my own daughter became ill with a post-viral condition, and Western medicine couldn't really support her to get back to school again. So I took her to an acupuncturist to see. It was a last resort for me, but it worked. And I'm quite happy if women come to me as a last resort. I don't mind how you find your way to acupuncture, but to come with an open mind and just to watch and see how you feel with it, and just to observe the results that we can get.
Excellent. And, I think, Mollie, you touched on this a little bit earlier when I asked you, what type of counselling is appropriate. But what should someone look for when they're choosing, a practitioner, be it a counsellor or someone else? And is it important that they stick with the same person?
Well, I think it's important that there is some sort of consistency, but, there's no point in sticking with the person who doesn't with whom you don't have a rapport or relationship. And so I think if you stay with a counsellor once, twice, 3 times, and the dynamic just doesn't feel right, then of course you've got to consider, moving on and seeking somebody who you do have a relationship with, a rapport with. So yes, it's, counselling or therapy is all about relationships. And if the relationship doesn't work, then you need to consider something else.
And is there anything, if you were to put yourself, on the other side of the table, if you were to try and choose a counsellor, rather, as opposed to sort of trial and error or trying blindly, are there things that people could look out for, or maybe some initial questions to ask when choosing a counsellor?
Well, I think especially when we're talking about fertility, we're looking for somebody who has experience in the fertility field. And I suppose I pride myself in that because I am a midwife and have a lot of clinical experience as well as psychological experience. And I, have worked in the field of fertility for the last 40 years. That doesn't mean to say that everybody is going to enjoy the way I engage with them. And so it's important for a client, to investigate and explore my background and what they what I think I can offer them.
And now, Carys, turning to you, similarly, when someone is looking to choose a practitioner of acupuncture, how would you recommend that people go about it?
So there are so many different qualifications in acupuncture, and it's not all regulated. We're not state registered at the moment. So I really would advise going to the British main professional body, which is the British Acupuncture Council. And they have a list of practitioners in your area who will be qualified to a certain standard. And I think that's really important to start there. But I think a lot of it is gaining a good rapport with your acupuncturist. I get a lot of very intimate disclosures, and it's a very personal thing. And acupuncture as a tool is not always for everybody. And I think the choice of a practitioner needs to be someone who you think you can gel with, because the more you can open up in those sessions, the more accurately the acupuncturist can choose points or best serve the individual. So rapport is really important, and don't be afraid to switch around. I sometimes think it's good to change practitioners after so many months, just to get a new view on the body. If you've had a bad experience, and I'm coming on to the next one a little bit here, is to try again. Don't give up. There are acupuncturists of varying skills and varying qualifications, and you do want someone who is Chinese medicine based, not just a physio who's doing a bit of acupuncture. You want someone who's holistically studied medicine at university for a period of time, who really knows their Western medicine behind it.
Makes sense. And just on both services, I think during the current lockdown restrictions, we are able to offer acupuncture in the clinic. Counselling we're continuing to do remotely for the time being, until the wider situation gets a bit better. But on that, there's one point which we didn't touch upon, which is acupressure. And I'm fairly ignorant, so actually if you could give us a brief description of what it is and how it can, whether it's as effective as acupuncture.
Acupressure is using the same acupuncture points, but just using pressure with the thumb as opposed to needles. I personally don't think it is as effective, but for people who have a needle phobia, it is a really good alternative. And sometimes in my sessions, I teach patients certain points they can stimulate, particularly over the ovaries, to increase follicular growth. So there is a real place for acupressure as well. And it is based on Chinese medicine and the same lines of meridian as acupuncture.
Excellent. Well, thank you both for fielding those questions. It's definitely quite informative for me. And at this point, I'd like to hand over to Carina for a bit of a wrap up, if that's okay.
Good evening, everyone. Thanks for joining us tonight. As one of the patient coordinators, I may have spoken to some of you already, But the message I want to leave with you tonight is that we understand that starting a fertility journey can be a daunting procedure, which is why we support you in many different ways. For example, our holistic services that we've talked about, counselling, acupuncture and hypnotherapy. And we want you to feel supported all the way through your journey. And if you have any questions or queries at all, please do reach out to us, either over telephone or email. There'll always be someone that you can talk to. If you know, I always say, if there's a certain time that you want to, if you have any questions, you want to call us, just let me know. I'm free. But yeah, we're all here to support your journey. Next slide, please. So one of the first steps, if you haven't already had one done, is to get a fertility checkup. And we do currently have our female fertility checkup on offer, as well as a new couples fertility checkup package. So, you know, feel free to contact me if you're interested, or if you have any questions about it at all, I'll be happy to discuss that with you. But essentially, please do reach out to us if you have any questions about any of our services, or if you're feeling worried or anxious. We're here to help you and put your mind at ease. Sometimes, I always say, sometimes, you know, if you just want to give us a call, just have a chat, you know, if you're worried about anything, about your upcoming appointments or anything, please always do. With the lockdown and now slowly easing, please do continue to be safe and consider getting vaccinated. And just on a final note, I'll just like to leave it with our next webinar, which is on lifestyle nutrition, which is scheduled for the 21st of May at 7:30. Please do check our website and register if you're interested. Thank you.
Thank you, Carina. So at this point, we'll open it up for any questions that you might have. Like I said earlier, you can pop it on the Q&A function if you have anything that you'd like answered. I actually have a couple that came through when I was preparing this for both Mollie and Carys. How have you found the impact of the pandemic on patients who are going through treatment? You know, and has it affected your therapy with them in any way? So Mollie, if we can start with you, if you don't mind.
Well, of course, it's affected the way we all work, Suvir. It's affected us, you know, I spoke about the fact that therapy and counselling is relational. And of course, you know, it's very difficult to have a close relationship with somebody who is sitting miles away and connecting remotely. However, I have also experienced the antithesis of that people say, because the fertility journey is so time consuming, that to engage remotely cuts down on some of the time that they have to invest in this process. In that, you know, some people take an hour to get to the clinic, they see me for 40 or 50 minutes, and then it takes them an hour to get back to wherever they've come from. So they can condense that, you know, and just cut out the two, you know, the two bits on either side and just deal with the middle bit.
And have you found that people, you know, because they are at home typically when they're seeing you as opposed to in the clinic, do they feel a bit more relaxed?
Not necessarily. I don't see any difference in that. I see people who engage with a counsellor because they have things that they either need to explore, or they have things that they want to get off their chest, they want to vent, they just want to be heard, they want support. And so I don't think it, you know, it interferes necessarily with the way they feel, relaxed or otherwise. I think, again, we've spoken about the stress and anxiety that fertility evokes in people, and therefore that anxiety and stress is with them even when they're at home.
Yeah, that's a fair point. No, I just, some of our doctors have mentioned that some patients feel a bit more comfortable when they first start talking about things because they are at home and not in a clinic setting. But Carys, the same question to you. You know, how's your experience been with fertility over the past year?
It's been interesting because during the first lockdown, we actually had our licenses removed from us, so I wasn't able to practice. We were bracketed with hairdressers and tattooists, but as the pandemic that we moved through the year, government have now recognised the value of acupuncture for stress and emotions. So for mental awareness. So the second and third lockdowns, we were brought out again and given a lot more scope to be able to treat. And that was music to my ears, because I always knew how large a part I could play with helping the emotions. And I just really, the courage of the patients, because I obviously come into the clinic every day, and the courage of the patients to be dealing with the IVF program during a pandemic, the stress is really on them. And they're all of them so brave. And I admire each one of them to be coming in. And I think that it's been good that they seem to look forward to their acupuncture. It is a break for them. Sometimes they say I'm the only person that they've seen, and I feel a bit sorry for them for that. But yeah, it's been working really well. And actually during this year, I think I've been busier in the clinic than I have been in previous years. And that's a reflection of the dedicated staff who have been turning up there every day. So I think it's been a really good year at the clinic for it.
And Carina, last but not least, because you speak to all our patients when they first start their journey, how have you found the change over the past year?
It's been very up and down, which one of the questions I get asked a lot is, are we going ahead with treatments? And yes, we are. We've just changed the way we work a little bit just to deal with the pandemic. But I think the remote consultations, I've heard some people say they prefer it, and due to the time constraints, if they're a lot of people are still working from home. So the fact that we do consultations throughout the day, and the fact that they're working from home, it works for them. But yeah, it's been very up and down. I guess with the in lockdown, out lockdown, we're all kind of figuring out what the next step is. But I think we've done well, and I think from a patient perspective, I think we're all used to now what the situation is. Non-physical consultations are done remotely, but the clinic is open, and we are open to support with everything.
Well, there are no further questions, so all that leaves is for me to thank our panel. So thank you very much for your time this evening and your very informative talk. So thank you, Mollie, thank you, Carys, and thank you, Carina. And I'd like to thank our audience for attending, and I'd like to wish you all a lovely weekend, and I hope you all get outside and enjoy the sunshine. Thank you very much. Have a good evening.
Thank you.